Hello.
Hello. Hi.
Hi.
Hi. Hello.
Hi.
Hi. Hi. How you doing?
Hello, sir. Can you hear us?
Yeah. Yeah. Definitely.
Okay. We're 11th graders in a U.S. high school. My name's Chad. I'm Finnegan. And I'm Caleb. And that's Derek. Um, what is any of you about our recent thing? To give a little general. Yeah, we're studying healthcare in Nigeria. Uh, we're trying to we're trying to interview and get like a diverse information basically. And then we'll
Okay.
contact you about the payment after the interview. Is that okay?
Yeah. Definitely.
Okay. So let's start off with some preface questions. What region of Nigeria do you live
Lagos.
in? Okay. Around what general age are you? You can give us a range
You
if you don't want to be specific.
you said what?
I said around what general age are you? You can give us a range if you don't
Age.
want to be specific.
Okay. Let me say 22 to 26.
Um, how how much do you trust the Martin healthcare system on a scale from 1 to 10?
How much do I trust?
Can you repeat that? Sorry.
You said what? You said how much do I trust what?
The modern healthcare system in Nigeria.
Oh, well, on a scale of 1 to 10, I would say I would give a 3.
A three? All right.
Yeah.
Do you have any family or children that you live with?
Yeah. I have a family I live with.
And do you live in a rural or urban area?
Yeah, urban.
Urban. Okay. Thank you.
Yeah.
So,
Yeah.
my first question is, tell us about your experience with healthcare in Nigeria.
My experience.
Mm-hmm.
Yeah. Well, when it comes to experience, I think there are many contexts to that. So, but generally, I've had a few experience with healthcare system and all. And well, it depends. I would say it depends because at times I get good services, and at times the services received are just not on par. So I feel it depends generally.
Okay.
Yeah.
What do you think some of the weaknesses are since you rated it a three?
You said what?
What are some of the weaknesses in Nigeria healthcare since you rated it a
Yeah,
three?
yeah, yeah. Okay, yeah. When it comes to modern health system, I think one of the advantages that the country should derive when it comes to modern health system is that there's a kind of there's a kind of system that can reach out to everyone across the country. So when it comes to modern health system, there are specific places in the country where they can be found. So in many clinics, in many hospitals where these things are not found, they have to refer the ill or the patient to those places where we have modern health system. And in fact, many times on getting there, you still find out that the equipment or whatever they have on ground is not enough for people that are coming in. So that is why I gave it a 3.
Sure. So, how far away would you say is your nearest healthcare center?
You said what?
How far away is your nearest health center?
How far away
Yes, yes.
is am I from what?
Your like nearest clinic, hospital, or like doctor's office.
Okay, for me, not really far. Okay. The system in Nigeria, yeah, we have private hospitals and government owned hospitals. So if we are talking about private owned hospital, there are still about closer places about should I say an hour drive. So, but when it comes to government owned hospital, it's quite far away from here, and many times traffic congestion can even extend the time that it will take you to get to a government owned hospital. Yeah.
All right. What are some specific healthcare services you find particularly difficult or expensive to access?
Yeah. When it comes to when it comes to some when it comes to services like services relating to some cares like cancer and some there was a time I had about an issue that they needed a kind of an MRI scan for someone who was sick, and they had to refer and refer and refer before they could get an hospital that has an MRI scan that can perform a CT scan for the particular patient at that time. So facilities like that are not so common, and they are mostly needed in many hospitals. So I think that is one thing that is lacking, yeah, in many hospitals.
Okay.
Um,
And oh,
Have you ever had to like travel to a different city or region to receive a healthcare? If so, could you tell us about that?
Yes, definitely. Yeah, definitely. Yeah, there was a time, I think it was specifically, I think it was an issue regarding the heart, and we had to travel from Lagos to Ibadan, where we have this University College Hospital down there, UCH. So, and the patient we had to be referred down there just so that we can get a better a better a better treatment, because what was needed at that time was not present right here in the state. So also there was a time that uh, we had to be referred to, in fact, a long distance hospital. Yeah, it took about, I think, close to a 6 hour drive. Yeah, to get there, a 6 hour drive, just because the facility needed could only be found in that particular hospital. So that is another issue.
do you use public or private healthcare?
Yeah, public.
Public. Okay. Would you say there's a
Yeah.
lack of equipment sometimes?
You said?
Lack of resources.
Yeah.
Tell us about it if possible. What resources specifically are lacking?
Okay. I would say a lot of resources are lacking. Examples are hospital beds. Yeah. Yeah, I think in this region we have a lot of sick people coming in, entering, going to the hospital daily, daily, daily. So, and when it comes to people going in into hospitals like that, I think one of the first thing that is needed is hospital beds. And over time, I observed that the hospital beds are not enough. Yeah. Many times they just have to forcefully or unnecessarily discharge one just so that another can occupy. Yeah, yeah, another can occupy. And also we have a lot of, as I've been mentioning earlier, facilities that are lacking, a lot of facilities that are lacking, that are really needed. Um, okay, and also resources like, uh, one of the advantages of healthcare system that that every citizen should enjoy is accessibility. So, and one of the resources we're lacking is ambulances. Yeah, ambulances are not so common, considering the rate of incidence of diseases, injuries, and all accidents and all in the country. It is important that ambulances are within reach. It is important that ambulances are within reach. But if they are not within reach, I think it is risky. Yeah, it is risky because at the point where people need healthcare urgently, if an ambulance is unable to reach them as soon as possible, anything can happen from there. So that is another
Um,
thing. That is another thing. And what again? Yeah, some drugs. Yeah, yeah. There are some drugs that at times, when you come to the clinic and all, in not every clinic now, in some hospitals, they don't have the drugs and just have to go out to make the purchase and all like that. So drugs too can some resources that are somehow lacking here in the system.
um, are there any like technological innovations you think can improve the healthcare in Nigeria that y'all don't already have?
Yeah, definitely. Yeah, there are innovations that are needed. Yeah, and I would say the first thing I would even say when it comes to this innovation is that there should be a means where at any point in time a person who is ill can reach out. We watch movies here in Nigeria and we watch how in the US, in the UK, whenever they have issues like that regarding health, they are able to dial I think 911 now. Yeah. They dial 911 and they are attended to with immediate effect. So we've watched movies where things like that occur. But here in Nigeria, we don't have a means for that. Yeah. I can't really say, okay, when I have health issue, this is a number I can dial and I will be attended to as soon as possible. Yes. So that alone is an issue. So wherever you are, if you have any issue at all, you just have to find a way to sort yourself because there is no means to reach out to a healthcare professional or a healthcare center at that time. So that that is the first thing. And another thing I would add is that there should be availability of more equipment. Yeah, equipment in hospitals. Yeah, because in many hospitals it is sad. Yeah, it is sad that you just can't get the treatment you want immediately. You have to keep they have to keep referring you to other hospitals just because what is needed at that point in time, they don't have it. It is saddening and it's so painful. So equipment should be made available in hospitals. Yes, equipment should be made available in hospitals, in many hospitals, so that people can get the best, treatment they can anywhere, anytime. So also, hospital beds, as I mentioned earlier, if there's a way they can be, that hospital beds can be provided, in larger quantities, yeah, generally. Yeah, it's something that would really help the system. And if there's a system too, that can help people, get healthcare subsidized for them. Yeah, that is another thing because one of the issues we face here in Nigeria is that when it comes to healthcare system, are you saying something?
No, we're listening.
Okay. So when it comes to healthcare system, there are many people who can't afford the healthcare. Even at times when I go to the hospital and I want to get treated on something and I see, oh, this treatment option there's no way I could afford it. In fact, many people they resort to traditional method to take care of themselves, which is not always good for for the body. So the costs of purchase, the cost of treatment and all too, they are an issue. So if there's a way, costs and purchases, drugs, treatment options and all, if there's a way it can be, even if not made free, if it can be subsidized, yes, for people for convenience sake, yeah, it would really go a long way.
Okay. Thank you. So on that note, we kind of want to tell you about what our solution is, and because it relates to what you just talked about, like how it's hard to get in contact with professionals and get your specific needs taken care of. So basically, our goal is to link different parts of healthcare so it's more organized and more efficient when referring people to where they need to be and seeing what resources are available. So Derek, do you want to talk more about it?
Sure. So our main solution is that we're going to create like a platform, like an app, website. So basically it runs on anything, and there's two versions of it. One's just like a simple app or website that can run on like a mobile phone, and another one would be a kiosk that can run locally. So the person using it doesn't need to have a device or Wi-Fi or anything like that. So basically, we aim to connect all the different hospitals together since it's very separate right now. And basically our solution. So basically we're connecting all the different all the different sites and stuff so that the person using the app can see the different capacities and like wait times of the hospital, as well as some of the major differences such as like cost and providers like that. So it can also transfer different like records, medical records. For example, if you were sick with like malaria or something, you would easily be able to put in your symptoms on like the website. It'll give you like a basic treatment options, and then refer you to give you the options of the nearby hospitals that are like available, tell you their wait times, and also like estimated costs.
Yeah, I'm getting that.
Sorry, we didn't catch that.
Yeah, I understand all you're saying.
Do you have any comments or questions?
Oh, yeah, I have a comment. Yeah, I was going to suggest that too, and that was why I said it would have been a great thing if there is a means people can reach out to healthcare professionals or healthcare system or hospitals, clinics as soon as they develop an issue with their health. So, and I would say the idea of an app is one that would really be effective. Yeah, it would really be effective in the country. Yeah.
Okay. We plan to we plan to use the kiosks too. So people who don't have access to like internet or can't use the app can go in person to the hospital and see where they need to go or what their next step is.
Oh, all right.
Have you encountered any corruption or unethical practices within the healthcare system in Nigeria?
Yeah, I would say yes. I would say yeah because I've had and seen a few corrupt practices and all, and I think that is one of those things we are really suffering and we are really encountering here in the country. Many times government release funds for these hospitals to be used to improve the health system. And somehow, don't mind my use of my use of that, but one way or the other, they just find a way to, embezzle, yeah, embezzlement. Those people that are in power, those people that are in the leadership position, they take some percentages and keep in their pockets. So I think that is one of the issues we have been facing when it comes to healthcare system in the country. If you are being paid, if you are being sent some amount of money, if you are being funded just so that the healthcare system can improve, and you are taking in some percentage to your pocket, I think there is no way the healthcare system can improve. Yeah, there is no way it can improve. So those are some corrupt practices that, in fact, that is a major corrupt practice we have here when it comes to healthcare system in Nigeria. And also, when it comes to preferential treatment too, there are some preferential treatment that that I have even witnessed when it comes to healthcare system. Okay, I would explain myself. There are times that the equipment they have on ground at that point in time are not enough, and they just do a kind of rough selection, maybe based on familiarity, based on funding, or at times bribe. Some people who have who are well fed, who are richer than others, they kind of bribe the system, and they attend to them better than those who are not well, who are not really okay financially. So those type of corruption are so common, yeah, in the country. But majorly it is that part where they get funded, and one way or the other, they just they take some percentages in their pockets, and what they are meant to use the funding for, they do not use it. Yeah.
Okay. So on the topic of funding, what are your views on the National Health Insurance Scheme? And have you or your family?
Yeah, National Health Insurance Scheme. Yeah. When I studied that scheme for a while, I discovered that really it was meant for all Nigerians, but in one way or the other, it can't extend to all Nigerians. So I think it's kind of restricted to government workers, because there are some kind of documentations that needs to be made when it comes to the scheme. So it is not enough for all Nigerians, for all citizens. And this is because at the moment it is restricted only to formal workers, people that have that in one way or the other are connected. Yeah, their work is connected to the government. So now that does not cover those that are in the rural areas. Yeah, it doesn't extend to people in rural areas. So which means that whenever the people in rural areas have issues and they can't afford their treatment, NHIS might not be able to cover up those things for them. So yeah, it has some advantages, yeah, but it is an advantage to some selected few, yeah, but not an advantage to the citizens generally, as much as I know.
Oh, okay. So besides the NHIS, are there any healthcare insurance options that you have used, and are they affordable and accessible?
None.
Okay, so you mainly paid out of pocket.
You said?
Okay.
How do you think that healthcare funding and resource allocation could be improved in Nigeria?
Resource allocation, yeah. I think the first thing is funding should be improved. Yes, funding should be improved. Yeah, but another thing is that um, Funding, yeah, funding is the first thing. If we have enough funding in the country, I think it will go a long way. And secondly, there should be a standard system that can help to reach out to as many as possible. Yeah, to as many as possible. Because at times I just feel these things are not well planned. They are not well, how should I put it now? They are not ordered. Yeah, they are not done in an orderly manner. There are systems. Yes, yeah, there are systems that need to be put in place just so that just so that these things can be understandable. Or how should I put it? Sorry, there are systems that should be put in place just that so that these things can reach every nook and crannies of the country. But I think the systems are currently not being put in place. And at times, if the system are put in place, there are some people that are are causing some issues in between. They are not letting it get to where it is. So now I would suggest that instead of the manual system that has been put in place, if there's a way that there can be a kind of automatic system whereby everyone in one way or the other there is a central system and everyone can connect on their own. There is no reaching out to a personality, or reaching out, the men and people that are in these places, they kind of make it hard for people to get access to these resources. So if there's an automatic system that people by themselves can connect to, if it's like you said earlier, an app, a website that people can always log into, register, be a part of it, be in the system, they can have access to the resources and all. So I think it's a system that would really work out. And for people that are not literate, for illiterate, for those that are not learned, there should be a system like that also in hospitals where they can go to, they can register themselves and get into the system so that they can be a part also and can also derive from these resources. So that is one thing I would say. There should be a shift from a manual system to a kind of automatic system. Yeah.
Yeah, that makes sense. Thank you. And also,
Yeah.
regarding like disabilities and like the elderly, are there any current systems or like, for example, any like ramps or like accessibility for people that are disabled or people that are a bit older?
Yeah. For people that are older, I would say, yeah, in some part there are systems, there are things that are put in place for them. But unlike what I have studied or what I have heard about how it is done in many other countries, it is not up to par. It is not standard enough. There is a special care that should be given to the elderly ones, a special care that should be given to those that are disabled, but they don't have. There is no specific care allocated for them that I know of. Yeah, let me say that I know of, because I have elderly ones too, and many things when it comes to funding, when it comes to taking care of them, getting them taken care of. I observe that it is something you do on your own. Yeah, it is your load to carry. So the government are not totally involved, yeah, in it as they should. In fact, there are some places where the government is not even involved at all. So there is no specific care, I would say, for them. Yeah.
What are the biggest health challenges, and do you believe there's enough awareness and education about these challenges?
You said what? Can you come again, please?
What are the biggest health challenges in Nigeria, and do you believe there's enough awareness and education about them?
Yeah, when it comes to health awareness, yeah. Uh, the health awareness and education, they are trying their best when it comes to that, yeah. But health challenges, the major health challenges we have is accessibility, because I think when it comes to health system, one of the quality of a good health system should be accessibility, availability, and affordability. So yes, to access, it's hard to access. In fact, at times when I get to the hospital, I just have to sit. There was a time I was really sick and I had to sit in the waiting room to see a doctor. I was sitting there for close to 5 hours and I was terribly sick, terribly sick. I was there sweating. I had to even lie down on the bench there, just waiting for the doctor, stood up. I was so restless and I was there for 5 hours before I could meet up with the doctor. So accessibility, availability, we don't have enough healthcare system. There are some places where health system, hospitals, clinics are not found in the country. Yeah, most especially in rural areas. So there is no availability of these hospitals, these clinics, these systems for people that live in specific areas. And affordability too. The healthcare system is expensive. We've heard of many people who, in fact, in the long run, they lose their lives just because they don't want to go to the hospital. They prefer to die than to go to the hospital, and they place a large bill on them that they can't afford to pay. Because I've had people many times that say, "Oh, I would rather not go to the hospital because I have no money for treatment. I will be fine. I will be fine. I will be fine." People saying stuff like that. Meanwhile, they are feeling ill and they should really go to the hospital to get treated. So I think accessibility, availability, and affordability are one of the major issues we have. And when it comes to health education and awareness about these things, yes, they are creating awareness about, for example, the NHIS, but it's not getting to where it should get to. Yeah, for people who don't have access to the media, they have little to no information about these things. They have little to no information about how these things run. So there is people who don't have information about it. How would they gain access to it? There is no way they would gain access to it. So those are the issues we are facing, and I don't think there is enough education and awareness on them. Yeah.
Are there any cultural or social beliefs or practices that influence healthcare seeking behavior in your community?
Yeah, I think one major social belief is that uh it is better. People say stuff like it is better you stay at home because even if you go to the hospital, they will not give you the care you want. In fact, people then begin to suggest that traditional care would go a longer way than the modern healthcare system. Those are some beliefs, yeah, that we have around here.
Have you ever used like telemedicine or online consultation? If so, like what was your experience?
No, no, no. I've never. I don't think that has really been introduced here in the country. Telemedicine has not been introduced here in the country yet. So I've never used it. Yeah.
How often do people in Nigeria go to get checkups? Usually.
Oh, when it comes to checkup, people don't do that often. Yes. And I would say the main reason people don't go for checkup is because of finances. So people that go for checkup, they are people that are well-meaning, the rich, and people that have enough, so they can afford to pay for the checkup and all. And there are some people too who don't, see the need for a checkup. They just feel they are okay. They just feel they are doing fine. So I think for that, what is needed is awareness and education, just to let them know that there is a need to check your health. There's a need to know if there's a part of you that is, that you need treatment for and all. So, but generally, the main reason I think most people would, in fact, for me, I would love to go for a checkup, but when you get in and they begin to tell you the cost of checkup, you would rather just be on your own and all. Yeah.
Do you think lack of checkups may correlate to people like getting sick with preventable or lifestyle illnesses?
Like the polio.
Or that, or like diabetes or high blood pressure.
Yes, 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 actually, because many times when some people develop some illnesses, we hear things like, if you had come for checkup earlier than this, we would have found out that, okay, this thing is coming up, this thing is coming up, stuff like that. In fact, there are some people that we hear developed cancer, and if they had gone for checkup in the hospital, that they would have found out earlier than then that, oh yes, there is a tumor growing, or there is a cancerous cell that is growing in their body, and with that something can be done as soon as possible. So, but once people don't go for checkup, there's no way they can do some checkup. I think there is no way diseases like that will come up. Yes.
Onto more of topic about the employment of healthcare officials. Do you think that there's enough healthcare officials, or is there more of a deficit? What you said?
There is definitely a deficit. Yeah, there is definitely a deficit. We don't have enough doctors. We don't have enough nurses, and I would say it is not the fault of these healthcare workers, because we have enough medical schools in Nigeria, and we have many doctors graduating per year. But these doctors, at the end, we hear of them, traveling out, going out of the country to work in other countries. Yeah, and I really don't blame them. I really don't blame them, because working as a doctor, it involves a great thing, studying for years in the school, and now getting to become a doctor, and you are being paid a meager amount for the work you're doing. It is not encouraging. Working shift morning to night, at times work 48 hours stretch, be in the theater room, working day and night, just to ensure that people get a good health, people have good health, and you are being paid an amount which does not correlate. Even people that don't deal with human life, they get paid better than you. So many of them consider these reasons, and they move out of the country just so that they can go to where they will be better appreciated. So if it comes to healthcare workers, we are really lacking. We are really lacking.
Okay. How is health information documented? What's the process?
Health information, I think it's documented physically. They use files, and files majorly. Each patient, because, for example, a patient that is just registering, that is coming to a hospital for the first time, it would pay for an hospital card. Then it will get registered, get a card, then a file would be allocated to him or her. So any information about the disease, the illness, would be in the file. So even if if he or she is coming back to get treated, there is previous information already in the file. So he or she just has to bring the card, the hospital card. There is a number that is allocated for each person. So the file is searched for in the clinic, then the file is brought out. So previous information can be gotten, and whatever information, whatever treatment was made during that time will also be added to the file. So I think that is how information is being documented. Yeah.
So basically, one of our ideas was also to incorporate like a easy like documenting system as part of our solution. So hospitals would be able to add info to the patient's file, and it would all be digitized. So it'd be safer and also allow patients to easily transfer files if they move to a different area or hospital.
All right. That's a good one. That's a very good one.
And also, have you encountered any misinformation or myths about health and illness in your community?
No, I would say no.
What roles do NGOs and nonprofits play in Nigeria healthcare?
Yeah, I think to some extent they play a major role, yeah, because they assist in funding, they assist in settling, bills, hospital bills, and all, NGOs, yeah, they are doing a lot, yeah, when it comes to the system in the country. I would say they are doing quite a lot. They are helping. Yeah, there are NGOs that are just dedicated to helping people either subsidize
About 10
their
minutes, and then we start wrapping it up. 5 or so. Okay, just whenever.
Um, how do you think the healthcare system can attract and retain more qualified healthcare workers?
workers. You mean
How do you think
workers?
how do you think the healthcare system can like attract and retain experienced workers in Nigeria?
Yes, it's very simple, I would say. It's very simple and straightforward. Ensure They should ensure they pay them well. Because if I putting myself in their shoes, I cannot be working for hours and I'm getting paid an amount that doesn't even worth the effort I'm putting in place. So if these guys are getting paid reasonably, I feel many of them would wait. No one really wants to travel out to work. Everyone wants to do what they want to do and try their best for their country. Yes. So, but if they are not getting paid well, they would go away. So, but if there's a payment system, if they are being paid a reasonable amount, yes, a reasonable amount for their efforts, they will happily stay. In fact, most of them, if not all, would happily stay in the country and work. I think that is the best thing that can be done. And also, secondly, enough equipment. Yes, enough equipment. Because we hear of many countries where they use advanced technology and all. And I feel these doctors, they also have information about things like that, and they also want to have experience of these technologies. There are many technologies they have heard of and all, and they really want to experience it firsthand. So many of them also move out of the country just so that they can have ease of practice. So I think those are the two things that can be put in place. Higher pay and also provision of better equipment and all for their use in practice.
Okay. Do you think
Have you ever had to delay or forego healthcare services due to the cost?
You said what?
Did you ever have to delay or forego healthcare services due to the costs?
Due to cost. Yeah. I've heard of a delay. Yeah. Many times when the cost is beyond power, you just have to delay you just have to delay. Yeah, many times I've heard of it.
Do you think the instability of the Naira currency is, how do you think it affects healthcare?
Well, uh, it I can't really say about that, but I think it affects healthcare negatively because with the issue arising and all, healthcare system it's not stable. Yeah, because and I feel it's I feel it's unnecessary at times because many times when we get to the hospital and we are just inquisitive and curious about why cost is increasing, they make statements like, don't you know dollar is rising? Don't you know right naira is falling and stuff like that. Okay, so all right. How then is that uh affecting healthcare system? They begin to make explanations like the amount they purchase drug, the previous month is more expensive now. They need to purchase drug with, they need to purchase with a higher amount now. So I think that again, I think it affects negatively generally. Yes.
Okay, thank you.
Yeah.
A few more questions before we wrap the interview up. We would like to ask about the prescription process. How you
Prescription.
prescribing different medication.
Yeah, that is done by the doctor. Yeah, that is done by the doctor. You meet up with the doctor, then the prescription is given to you, and you get the drugs from the pharmacy.
Okay, thank you.
Yes.
Have we asked about pediatrics? No. Is there any difference between pediatric care and adult care?
No, no, no.
It's the same. Okay.
And do
Yeah,
parents typically take their kids to like health checkups on a regular basis, or is it more dependent on their income and financials?
yeah. It depends on their financials too. Yeah.
Okay. And how often do you get checkups?
Myself,
Mm-hmm.
oh, I've never gone for one.
Never.
Yeah.
Okay. Do you think the lack of checkups might lead to like lifestyle? I already asked. All right, my fault. Okay. I think we've asked all our questions. Sorry for repeating a question at the end.
All right.
Thank you for your time, man.
Thank you. That should be all. I'll contact you right after the call on WhatsApp to arrange the payment process. And
All right.
all right, thank you.
I'm sorry.
Okay.
Goodbye.
Thank you.
Yep.
Thank you so much.
All right, we appreciate your time. Goodbye.
Yeah, goodbye.
Goodbye. Have a
Yeah,
good one.
goodbye. Yeah, thank you.